What to do if budesonide isn't working? If you are wondering what steps to take when budesonide is not providing the relief you need, you are not alone. Budesonide is a corticosteroid medication often prescribed for inflammatory bowel disease, which includes conditions like Crohn's disease and colitis. It works by reducing inflammation in the digestive tract. However, if you find that it is not effective for you, there are several actions you can consider. First, it is essential to consult your healthcare provider. This is the most important step. Your doctor or gastroenterologist can evaluate why budesonide is not working. They will look into factors such as the severity of your condition, whether the diagnosis is correct, or if there are issues with how your body absorbs the medication. Next, reviewing your diagnosis and symptoms is crucial. Inflammatory bowel disease and irritable bowel syndrome can have similar symptoms but requiring different treatments. Budesonide is effective for inflammation in inflammatory bowel disease but not for irritable bowel syndrome, which does not involve inflammation. If your symptoms persist, your doctor may need to reassess your diagnosis. Another factor to consider is medication adherence and formulation. Budesonide comes in various forms that target specific parts of the intestine. It is important to ensure you are using the right formulation and taking it correctly, whether with or without food. Sometimes, switching formulations or adjusting the dose can make a difference. If budesonide alone is not enough, your doctor may suggest alternative or additional medications. For example, aminosalicylates, such as mesalamine, can help target inflammation in the colon. In more severe cases, immunosuppressants or biologics like adalimumab or vedolizumab may be recommended. If there are concerns about infections or bacterial imbalances, antibiotics or other therapies may also be considered. Lifestyle and dietary adjustments can also play a significant role, especially for those with sensitive stomachs. You may want to avoid trigger foods that worsen your symptoms, such as spicy or fatty foods. Eating smaller, more frequent meals can help, as can staying hydrated and avoiding caffeine and alcohol. Some people find that probiotics or supplements support their gut health. If you experience symptoms of irritable bowel syndrome alongside inflammatory bowel disease, additional treatments may be necessary. Medications that help manage bowel movements and pain perception can provide relief, even though they do not treat inflammation. Lastly, regular monitoring is important. Your healthcare provider may recommend clinical evaluations, blood tests, stool tests, or imaging to track your disease activity. This ongoing assessment will help adjust your treatment plan as needed. If budesonide is not working for you, it is vital to reassess your diagnosis, medication regimen, and lifestyle factors. A tailored approach that combines medical therapy with symptom management is key to improving your situation. Always work closely with your healthcare provider to find the most effective treatment plan for your needs.